So today I'm going to be doing my IM injection video. So for this, I'm going to check to make sure I have the right client, right drug, right dose, right time, right route, and right documentation. I'm going to make sure the client has no allergies, that the procedure is explained, and that it is in a private setting. I would wash my hands and apply gloves in a normal setting. And then I will be using these 2 vials. I will cleanse them with an alcohol prep pad here. Because it is multi-dose. Then I'm going to use this syringe. I'm going to inject air into my sterile water, turn it upside down, pull out my actual dose or my sterile water. Then I'm going to push my sterile water into my powder, roll it to reconstitute it to make sure that it is all well combined. Then using this same syringe, I'm going to push air in, turn around, pull up my actual dose or this needle, pull up my actual dose. Then I'm going to switch into my 21 to 25 gauge needle with my 1 inch to 1.5 inch, 21 to 25 gauge, 1 to 1.5 inch needle for this procedure. And then I'm going to I'm going to check for air bubbles at all times to make sure that it's not an improper dose. So I'm going to go 3 fingers with below the acromion process, 3 fingers with above the deltoid insertion point, and then I'm going to cleanse it with an alcohol prep pad, leave that there to mark my location. I'm going to uncap my needle. I'm going to pull the skin taut, injecting at a 90-degree angle. I'm going to aspirate for blood. Then I'm going to give my actual dose. I'm going to pull it out, activate the safety, place a Band-Aid on the client. However, I'm just going to use the scoop method, but normally I would throw it in the sharps container. Make sure she's feeling okay, and then that will be my IM injection. Some other sites that we can go is the vastus lateralis. That is also a 21 to 25 gauge. It can hold up to 2 to 5 milliliters of fluid, and it is a 5/8 to 1 inch needle there. I'm going to go 1 hand's length below the greater trochanter, 1 hand's width above the knee, and inject right in the middle there. Then I'm going to be doing my ventrogluteal, which is my thumb is going to be pointed towards my abdomen, pointer finger towards the anterior superior iliac crest, and then I'm going to spread my middle fingers, and those are going to be pointing towards the posterior iliac crest, and then I'm going to inject right in the V here. This is a 21 to 25 gauge, a 1.5 inch needle, and it can hold up to 2 to 5 milliliters of fluid. The deltoid can only hold up to 3 milliliters of fluid, and that is recommended in 2 separate doses. And then dorsal gluteal is one I'll never do because it is too close to the sciatic nerve.